Hello, healthcare enthusiasts, and welcome back to The Cure. We are live at WHX Lagos 2026. We have with us a very esteemed guest, Dr. Jide Idris, the Director General of the Nigerian Centre for Disease Control and Prevention. Thank you so much, Dr. Idris, for taking the time to speak with us.
You're welcome. Thank you for harassing me.
That's an inside joke. My first question to you, you took over the NCDC in February 2024. You've been in the role for 2 years. And, right now we have active Ebola pandemic threats. We have the memory of the COVID-19 pandemic still very much alive. I would love to understand from you, what does that look like in reality in terms of your mandate and how you run the NCDC and the importance of governance in your role in the NCDC?
Let me say that my mandate is not health security.
Mm-hmm.
And that basically means that you have the job of securing the health of the people of Nigeria.
Yeah.
Protecting them from communicable diseases where you can. And it's a tough job because people do not realize the scope of it. And again, what brought about that has to do with our experience as a nation. When you had the Ebola outbreak in 2014, and I had the COVID outbreak.
Yeah. Those
two outbreaks brought to the fore the fact that there's so many things to address in this country. Our system is still fragile because we really do not really understand the kind of vulnerabilities we have. And any one epidemic can wipe out so many people.
Yeah.
Much more than whether you have road traffic accidents or whether I did across this country in 1 year, not by one epidemic. And that's why it's an emergency situation. And in dealing with an emergencies, you need proper governance.
Yeah.
The first thing they taught you, or they taught when you had this Ebola thing, is incident command system. Incident management system. Basically, just like governance, if we have no structure, we have no proper governance system in place, the system becomes chaotic.
Yeah.
And like I did say, governance covers so many things. Leadership and governance, it covers policies. So if you relate policies to NCDC, I've told you what we are supposed to do as NCDC.
Yeah.
National security. It takes legislation because, let's say roles and responsibilities. If you have many people involved in health security, many people involved in NCDC, but each one of them must have their clear roles and responsibilities.
Yeah.
If not, they're going to be in clash. They're going to be chaos. Everybody does what he likes. So that roles and responsibilities must get clocked. Who does what, when, and how?
Yeah.
This must be clear. You must have legislation, because without legislation, we can't do much. Legislation confers legitimacy to NCDC. It confers legitimacy to any government whose responsibility is. And it also ensures continuity. So that if you have the proper legislation prescribes what to do as an institution, how it is done, what kind of staff you can recruit, how is money appropriated to what you use.
Yeah.
If that is not there, you can't do much. That's what. So about legislation establishes continuity. So if you have a different government and that law is still there, very difficult for the new government to change whatever. Unless he also goes back to the legislature and changes the law.
Yeah.
And changing the law again takes quite a long time. Then you have regulations. There are many activities happening. Different people working. All these things have to be regulated to maintain a clear, seamless thing.
Yeah.
Or else again, this one does his own, that one does his own, nobody is regulated. You remember what happened there now? Telemedicine. Everybody comes in there, wants to do telemedicine. Put up this one. So doctor comes, you don't know what kind of doctor he is, you don't know what his capabilities are.
Yeah.
You don't know how good he is. You don't know whether he has a certificate. So if such things are not regulated, the chances are that your output, you may not actually achieve your output outcome.
Yeah.
That's okay. Then again, accountability as a government, you are using government funding, you are using other people's funding. These people work for their money or find a way of raising their money. But again, they give you this money to do what you want to do. You must be able to account for the money.
Yeah.
At the end of the day, what did you do with the money? How did you spend the money?
Yeah.
If you cannot account for it, the chance that you never get that kind of support again later.
Yeah.
So all these people you want to now going back to NCDC. NCDC was created both based on the experiences of Ebola and COVID. Because that it showed us that we are not ready for public health emergencies.
Yeah.
And that's why again they started putting structures in place. I was lucky to have predecessors who started building on this. So it's what I'm inheriting. So in managing all those things again, you have to look at what happened before in the past.
Yeah.
What is happening now? Is the processes, are the processes you used before, are they still relevant now? These are the issues here. And again, the CDC is supposed to be National Public Health Institute.
Yeah.
And all our work is research based. So we continually do research on diseases you come across, all the things that become of disease. As the findings come again, you think that you need to improve. Take for instance, the current Ebola. The Ebola we used to are the Zaire type strains. Took a while before they developed vaccines and therapeutics for it. This one now, no vaccine, no therapeutics.
Yeah.
So some researchers are working already on how to do this.
Okay.
So you understand? So right now, you can't treat it. Just like we couldn't treat Ebola then or the vaccines came. Now we can't treat it.
Yeah.
So what do? You rely on that basic public health infrastructure that has been built over the time. The other is prevention. What we are doing now is how do you prevent this thing from coming to this country? Because it's not here yet. But should you not be able to 100% prevent it? When it comes in, you must be in a position to quickly detect it and isolate those patients.
Yeah.
Because if you don't, it's going to spread. So if you isolate them, you now look at put their isolation, how do you treat them? And of course now, who have they been in contact with? They got spreads.
Yeah.
So you have to do contact tracing. And then as you isolate, are you sure it's Ebola they have? That they have to do that test, diagnostic test, using our laboratories. These laboratories now, they evolve constantly. So the highest now, we're using the genomic sequencing thing, which is the highest level.
Yeah.
And the plan is to build that genomic capabilities. Because then it is faster. You don't have to go through the rudiments of using microscope and do all this I used to do before. But again, it requires other things.
Yeah.
It requires bioinformaticians, which we don't have here. You need to train them.
Yeah.
It requires training. It also requires stockpiling. Prepare. You don't wait until that thing comes. You have to prepare.
Yeah.
In this country, people don't understand why they should spend money to prepare for what you don't even know is going to come. But when it comes, everybody starts running helter-skelter. So if you don't have that system in place again, it's also chaos.
Yeah. Yeah.
So these are the things again. That's why governance is very key. The rudiments of governance is very key.
Yeah.
And of course, if you are getting money, if you use the money somebody gave you free of charge, diligently, accountably, they expect to give you more.
Yeah.
But if you don't, you get the money again. And does our government have enough money to give us? The answer is no.
Yeah.
Because no government will have all the money you require. So we need again. So that's why the partnerships, building. So when I got to NCDC, prevention was the weakest link. So we have to develop a department for prevention, disease prevention. If you can prevent the disease coming in, you're almost home and dry.
Yeah.
They have a surveillance or early warning system. It's more like data tracking. You track data, you track occurrence of disease in many ways. You can use hospital data. You can get information from the community. You can even get information from mining information from newspapers, the website, and everything like that. But the point is that if you analyze those things and you see a particular trend, it's a trigger.
Yeah.
You can now send people to investigate.
Yeah.
You build your laboratories. You constantly renew your laboratories. change the equipment you have again to be the modern thing so that you can do it properly.
Yeah.
You must educate people. Communications. Let the people know what you are doing, why they should do certain things, what they should do. And in doing that, it's not easy. Communication is not easy. You have to build the trust of the people. Or else you just be wasting your time. You tell them to sit down, it's okay. We said them sit down. When you go, they will stand up. So these are the issues here. It's all governance related.
Yes.
It's all again is that you build from past experiences, knowledge base, and start addressing what you have.
Yeah. And speaking of past experiences, obviously we're here in Lagos.
Yeah.
You were the Commissioner for Health for Lagos for almost 2 decades.
I don't know about that.
And over 10 years ago, you were at the forefront of the 2014 Ebola outbreak in Lagos. And I think that's a case study for, outbreak response. I would love to hear how your experience as the Lagos State Commissioner for Health has informed your new role as the Director General of the NCDC. What have you taken from Lagos that you're now applying at a more federal level? What are some lessons learned?
Let me say that, I always believe that knowledge, any form of knowledge is never lost. You never know when you have to use it.
Yeah.
And let me say in Lagos, when Ebola struck, we had no clue what Ebola was. We just saw people running, people dying. But we were lucky in saying that we had some experts who came from outside.
Yeah.
USCDC, WHO, and all this stuff. They gave the knowledge of what Ebola is. They taught us how to handle that.
Yeah.
And that's like if you relate that to what we were taught in school, infectious disease, barrier nursing, hand washing.
Yeah.
All this they may seem little or small. But they've come a lot because when you say IPC, infection prevention and control, if you do that properly, if you have that culture in this country, you can address so many diseases, including Ebola.
Yeah.
Take Ebola now, how does it spread? Contact with body fluids. It could be saliva, it could be blood, it could be sweat, anything. But if you can break that contact between the people, you're almost home and dry. Because that virus cannot spread. But how do you break that contact? You protect yourself. You protect the people with you.
Yeah.
How do you protect? Gloves, wash hands regularly. Health workers must go on there and protect themselves again. And be on the alert that the person with a fever may not necessarily be malaria.
Yeah.
So you have to understand again how Ebola presents. Once you see that again, it's a trigger. You check, you detect.
Yeah.
Laboratory. You have to go to laboratory and have the capability to detect, because Ebola is what they call organism of high consequence pathogen. It's not any lab that can detect Ebola. It has to be BSA 3 labs.
Okay.
They require special expertise. They require special equipment. They require special processes, policies. I see people have to be trained on how to use that.
Yeah.
That's how we can develop as a country. That's the case. We're trying to build such capacities in NCDC. And case management. How do you manage these cases? You have to look for people who have the knowledge. That's why, again, I've had this experience of, I started work as a clinician, as a doctor. Okay? It's a totally different perspective. You moved into management. How do you combine people working together, different expertise? How do you put all that together to achieve what you do? Now, move to NCDC, that is science-based. You find that most of the people we are working with are not doctors.
Yeah.
Most are not doctors. Most are not nurses. They are scientists, microbiologists, laboratory technologists, communications experts. These are people we never actually thought we want to work with.
Yeah.
But again, without them, the doctor can't do much. So you need to understand now, let your guards down, be more open, get in people again, and you learn every day.
Yeah.
So if you put that together, you are a better person for it. Because now you've not limited yourself to one particular area of expertise.
Yeah. Stop that. My final question for you.
Okay. I'm going to go.
As we think about the Ebola outbreak that's happening in DRC and as well as in Uganda. Can you tell us what is the NCDC doing to prepare? You've already mentioned stockpiling and making sure we actually have the resources we need before anything happens. But what else can you tell us that the NCDC...
One thing is that look at what is happening in DRC, Uganda. We told you a lot of people are dying. No vaccines, no drugs. Even a lot of the cases are not being detected because they are rural, there's like community spread. But this is spreading fast. It can come into this country anytime. Number of rising. We have a huge urban population here. We have porous borders in this country. So the first thing you want to do is don't even allow it to come in at all. So what we're looking at again, first is the points of entry. Airports. You have to build capacity at the airports. It is tough in a country where law and order is key. Everybody is running up and down. You have to create order. It's all related to governance. And the airports again, it's not only health workers working there. You have aviation officials, FAN, NCAA, immigration. All of them have to work together to create that order. What we do is supply them, and that's why what they are doing now is that electronically, people have to put that declaration form before they board any flights or anywhere coming here. And when they fill that declaration form, electronically it is transmitted here. So you know who might be suspects, whether they have fever. If they are coming from that area, they fill that case definition. Somebody with fever, body aches and all, maybe bleeding, but the history of travel from that place. The person becomes a suspect. Doesn't necessarily have to Ebola. But you bring the person aside. Now you test. But before you test, you isolate so that you don't know whether the person is conscious or not. You test or isolate. Then you test. If you are not sure, you follow up for the next 21 days because incubation period for Ebola is 2 to 21 days. Monitor temperature, monitor whatever exercise you want to do that. So that you don't see anything change. Once you notice any changes, you do that. While they're doing that again, if you suspect, make a diagnosis. Take your blood sample. Taking blood sample is not just any blood sample. You have to be careful. You have to be properly treated. So that you are not infected. So the idea is prevent the virus from coming into this country. But why it cannot fully prevent, because you can't prevent 100%. As a building our support service infrastructure in-house at the back end. When I say support, laboratory systems, case management, communications, surveillance. How do you now track these things from different parts of the country? So you build capacity. And unfortunately now we have a huge population. We have many states. So it's only NCDC. Now NCDC supports now to give support to the states. Each state again must be able to put up some degree of structure, emergency response system, just like we do at NCDC. They should be able to do sub-nationally. Our role now is to build that capacity at the sub-national level. So that because this disease occurs in the communities anyway, before we know, it's already in the community. So we have to find a way of detecting this from the community, and they can tell us, relate to us, okay, this is what is happening. They send people there to go and check and that kind of thing. So which laboratories do you want to use? More special laboratories. It's not all that have laboratories. So they are more like tiered. The tier 1, tier 2, tier 3. So we decide again who to whom. If it's to collect samples in one remote area, you have to find a way of collecting sample and transporting the sample in a safe way. And that's why you have systems of sample collection. That's the same way you say system again for distributing this thing. So develop rapid response teams to states where you think you need them. Like say stockpile. You don't wait until the thing happens. If you know this is Lassa fever or this is Ebola period, you start thinking, what you need to react to this? So start purchasing those things and keeping them. Once you start noticing again cases against, you send them out to this to help them so that it's a complex thing. But it's interesting. Because it brings people, different experience of people together to be able to address these issues. Am I free now?
Yes. Thank you, Dr. Idris, so much for taking the time to speak with us. All right. See you in the next episode. Bye.
Yeah.